Hey, everybody. Jenna Vegno from the Health Department. Really excited to be moderating, participating in this panel, and a huge thank you to the Urban League and all of the partners that made this fantastic policy conference happen. Really nice to be with you all once again. As I said, I'm the director of the New Orleans Health Department. I would love for my colleagues, Jeff Schwartz and Charlotte Parent, just to do a really quick introductions before we get started.
Jeff can't hear you.
I apologize. I was just saying, Charlotte, you should go next.
Okay.
If you don't mind.
No, not a problem. Good afternoon, everyone. My name is Charlotte Parent. I am the Vice President for Business Development at University Medical Center, part of the LCMC health system here in New Orleans, and am responsible at the hospital for our community health needs assessment and community work that happens within the hospital and the system.
All right. And as Dr. Vegno said, I am Jeff Schwartz. I have the honor of serving as the director of the Office of Economic Development for the city of New Orleans. I will hopefully be able to touch on this a little bit later in the discussion. But in addition to how important this work is in my current role, I also spent over a decade doing community and economic development work in the Broad Street corridor and neighborhoods. For those of you that are in New Orleans or are familiar with it, where we worked on health and health equity related issues as a means of addressing a lot of longstanding community needs. So the topic today is near and dear to my heart. So I am honored and very happy to be here with you all today. Looking forward to the discussion.
Well, great. Let's dive right in. We're going to kick off. I'm going to do just a really brief overview of some recent work that with our partners we have put out about the intersection of health and economic prosperity, what needs to be done to improve both. And then we'll kick it over to both Charlotte and Jeff to talk a little bit about their pieces of this. And then we'll have some discussion and really looking forward to any questions that you might have. So Mallory, thank you for advancing slides. If you wouldn't mind doing the next slide. So I think, I want to frame the discussion of health being wealth with a little bit of explanation of context where that comes from. Until maybe 20 plus years ago, the only model of good health or poor health was, whatever anatomic, physiologic, or family history qualities that an individual had that either predispose them to have certain medical conditions or to be unhealthy in some way. We really did not take into account all the factors around an individual that determine what their chances of getting diabetes, of dying prematurely, of having an injury-related illness or death. What we've really found in the last few years is that what we understand as making up good health has very, very little to do with what the biology that's within each of us or what we might have inherited through mom and dad. What really determines whether or not we are going to be healthy or unhealthy, whether we are going to get cancer, heart disease, all of the things that plague us as Louisianians, has to do with what we call the social determinants of health or social needs, to a factor of about 80% of the total chance of being healthy or unhealthy. And so the focus for those of us in public health and also in clinical care is working to address those social needs as a way to get our patients healthier. As a physician, if I diagnose you with an infection and I write you antibiotic prescription for that infection, I assume that that's going to take care of the problem. However, if you don't have access to transportation to go to a drugstore and pick up that prescription, if you have a low wage job, that means that that price of that prescription is out of reach. If you don't have access to insurance because of your particular employment, if the neighborhood that you live in is remote and doesn't have any traditional healthcare or pharmacies in it, then you're not going to be healthy. And in fact, you're going to get worse. None of that has anything to do with how bad or not bad your infection was, or what your body might be doing to fight it off. So just want to sort of lay the foundation. And the whole concept of health and wealth is that the things that make people largely unhealthy or healthy are the same things that create either a poor, non-thriving community or a prosperous one. And investment in the factors that determine this is going to make us both healthy and wealthy. So just wanted to kind of set the stage for the conversation. Next slide. We cannot talk about health in New Orleans or anywhere else without really owning and understanding the entrenched inequities in all phases of what makes us healthy or not. Whether it's the downstream effects of a profoundly inequitable society, or whether it is neighborhoods, whether it is education rates, income, all of these are and have not been for generations inequitable. This is some sort of local specific data, and you can see that every marker of both clinical diagnoses as well as social determinants, there is a race gap, meaning that for Black New Orleanians, the rates of all of these are much higher. And until we make that a focus of any work and at the foundation of what we plan to do, then we're really going to miss the mark in terms of how to improve the overall health of our entire community. Next slide. So what's the plan? As a local health department, we have to do a deep comprehensive community health assessment every 3 to 5 years. Basically, what is the state of the union in terms of health? What are the things that plague us in terms of poor outcomes? What are the barriers? And describe it. So in 2019, end of 2019, we came, after 2 years of work, came out with our community health assessment. We had many, many partners in this work. This is not just something that the New Orleans Health Department does in an ivory tower and distributes. This is really engaging, interactive, collaborative work from all sectors of the community and every kind of business, nonprofit, every organization that you can think of. Once we have an assessment, we need to do something about it. And so for the last 2 years, with a little bit more extended due to COVID than we would like, we have taken the work of the assessment and turned it into an action plan. We know what the problems are. How do we need to address it? So it's a 3-year plan in which the health department serves as the convener and the backbone, but one of many equal partners who all have a role to play. We aim to make it inclusive, equitable, and true partnerships across the city with shared goals and shared accountability, because certainly this is not something that we could ever do by ourselves. So that was released just a few weeks ago. If you go to the health department website, you will be able to read it in all its detail. Next slide. So briefly, what are the most important things that we believe need to be worked on in order to truly create a transformation in health? 3 main priorities. Number 1, increasing access to care. Number 2, and this goes back to those social determinants, improving economic stability. There's probably nothing greater we can do for the medical and clinical health of our population than improve the stability of their finances and the environment in which they live. And number 3, ensure community safety. And I'm just going to drill down a little bit into these. Next slide. So talking about access to care, we are very, very fortunate in Louisiana to be a Medicaid expansion state, and the impacts of that are tremendous and will be felt for years to come. We're probably only beginning to measure the benefits of that. But I do think sometimes there's this misconception that if we just gave everybody insurance, that's access. That's one piece of access, and it's a critical piece, but barriers to access take many, many forms. As I said, it's having reliable transportation to get you to work, the grocery store, the doctor's appointment, the pharmacy on time, having education levels that are sufficient to be health literate and really understand medical conditions and what you need to do to take care of yourself, having the basic income so that you don't have to make a choice between should I buy this prescription or do I pay my rent? All of those go into creating barriers to access. And we've got just a couple of statistics here that highlight the work, but these are the outcomes. We have large numbers of deaths from chronic diseases that are in many ways preventable. We have really staggering rates of maternal and infant mortality, which again, with better access and a variety of those social needs addressed would be much better. And a lot of what we see in terms of behavioral health stems from challenges with access. Next slide. Oh, I don't know why this is it's a little bit messed up, but just so you can get an idea of within this question of access, we think there are some really key foundational issues to address. Chronic disease is what kills the vast majority of us here in New Orleans, in Louisiana, and in the US. Much of this burden can be alleviated if we really transform the way we do preventative care and help people gain access to some things that are going to make them a lot healthier. So that's a big one. There is no better investment than maternal child health. When you invest money in young families, in prepartum, birthing, and postpartum mothers, the gains on that investment extend to the life of the mother and throughout the life cycle of the child. If you get that wrong, you will not only reap those consequences in a health aspect for years to come, but also an economic aspect. So we feel like one of the biggest foundations that we need to invest in is maternal child health. And then everyone has seen the burden of lack of access to quality behavioral health services. And it's only going to get worse, as we've sort of seen through COVID. Next slide. The next goal, again, improving economic stability. We don't score very well in terms of any measure of economic stability, no matter how you slice it, whether we're talking about poverty rates. In a city like New Orleans, with the greatest food in the world, to be profoundly food insecure is really a tragedy and one of our own making. Our income inequality is stark. We have one of the lowest, if not the lowest, minimum wage. It is impossible to provide for an individual or in a family on the minimum wage in New Orleans, particularly when we are a high renter community. And we know that many of our renters have significant issues simply keeping the lights on and keeping a roof over their head. When you are worrying about all these basic needs, you are not going to prioritize what you need to do to be healthy. And it translates to far worse outcomes and a lot of premature deaths. Next slide. So I've highlighted here, these are in our health improvement plan, but if you look at the yellow boxes in particular, this is probably part of Jeff's economic development plan that he's going to talk about, right? Again, it's this double return on investment. When you invest in home ownership, you get benefits to the economy and prosperity, and you get health benefits for that entire family. So making these investments are some of the smartest things that we could do. If I told you if you invested your dollar, it would double, somebody would match it, you would absolutely do that. And so that's what we need to do as a community. Next slide. And then our last priority is community safety. And safety takes many forms, right? Certainly the threat of violence, whether it's interpersonal, domestic violence, that we've all lived with for far too long, leads to staggeringly low life expectancies among some of our community and bogs down how we are able to have a workforce that is productive throughout a long life cycle. But it's other threats. It's climate threats. it's urban heat, and of course, it's the infectious disease threat that we faced most prominently the last 2 years with COVID, but COVID is not the first nor the last infectious disease outbreak that we're going to have to face. Next slide. Again, this is mostly yellow because so many of what makes things that make us unsafe and thus unhealthy are critical concepts for how we need to better invest in protecting all of our citizens, whether it is from violent crime, whether it is from unsafe roads, risky driving. All of this is necessary to build the city and the community of the future, both in health and economic development. Next slide. So really what we want to, talk to you, and what I'm hoping Charlotte and Jeff are going to help bring together is, if we want to be a healthier city, it can't just be the New Orleans Health Department, a couple of our clinics, and our hospitals. It is so much broader than that, as I hope we've shown you, that it really is going to take different thinking, different partnerships in order to get it done. But if we can get it right, the gains are going to be far greater than health alone. So I'm going to toss it to Charlotte now, and I think we can stop sharing slides so she can talk about sort of the traditional hospital healthcare systems and how they're approaching the work of improving the community health.
All right, so some of this is going to be, I guess, in some ways a little bit redundant, but that's the good thing, right? Because the intent is that we are aligning the work that's happening, whether it is happening within health systems or whether it's happening within public health. And the hospital systems, I'm not exactly sure how many years I've been involved in the last 3 iterations of the community health needs assessments that are done by health systems, have had to produce this document through let me make sure I get it right, the Patient Protection and Affordable Care Act. Okay, so basically what I can say to you all, to this group who would understand this was a governmental mandate that if you're a not-for-profit hospital, right, they want to know how you are investing back in the community. And so it is really an IRS mandate that we do this. So every 3 years, hospitals are required, not-for-profit hospitals are required to complete a community health needs assessment. That assessment involves your hospital partners. It's almost the same as what Jen is doing at the health department. We do surveys with the community. We do roundtables with the community. We talk to our patients. We talk to our doctors and providers and our employees, and we get from them what they believe to be the priorities for the community in the area. It is a combination of qualitative and quantitative data. Ours is, I think, 1 year off from the cities. I hope one day we'll be able to figure out how to get these on the same time frame. We might have missed our opportunity with COVID since everything kind of got thrown together. But the point being that you hope that you can create a true community plan, right? So that you're working from the same things. But for the most part, the community basically told us the same things, right? The only difference being for the health system, we're looking at it as our way of how do we connect to the community through the services and things that we do versus the bigger picture that Dr. Avegno looks at through public health. So the things that came up, we conducted ours last year, and this is a year-long project for us in terms of getting the assessment done. And the way it's done in our area is we do a joint report, which is a combination of both health systems and other hospitals, not-for-profits that are part of the Louisiana Hospital Association and want to basically join forces to get this done. It works for a couple of ways. It keeps the same people from asking the same questions to the same groups. We partner to look at that, and at the end of the day, what should come out of this is that each hospital or system at that point can develop implementation plans that when you put our plans together, right, we should be able to create some impact because we're working on the same type of things. So when we conducted the plan this year, and did the work. The big ticket items that came out with for priorities were some of the same things that Jen saw: education and health literacy, the environmental factors, right? So some of those things that we talked about in terms of climate change and what's happening with that, health equity and discrimination in healthcare. There was a lot of comments about how our citizens feel that there's bias, right, in our healthcare systems, and they're not receiving what they need. Providers aren't listening to them. There's implicit bias in terms of how they decide they treat them, right, or making assumptions about what that treatment should be. Infrastructure work about how we provide that care, mental and behavioral health, poverty and economic opportunity, and for the health systems, violence came up, right, as the big ticket, right? That is the part of it, especially in Orleans Parish. It was clearer in Orleans that this was an issue, but we needed to think about it in terms of what can a health system do, right, to affect that. And we are more focused on the impacts, the health impacts of violence, and what does that look like? So these pieces came up, and then each hospital looks at this and decides what are the ones that you are going to focus on, that you feel you have the assets to do some work with. And we then chose that, and each hospital is now building out their implementation plan around those choices. Now, these assessments, just like the city's assessment is on a city site, every hospital has this assessment up on their website. You should be able to pull it. You should also be able to find the older ones to see where they are and the progress or work that had been done. This year, when you pull it up, the report is the same, basically, for every hospital. The data is the same, but the focuses are a little different. And so that's usually the process. We're in the process now of building out the implementation plan. That is going to be a 6-month process. Those are due to the IRS by May 31st, but the work goes for 3 years, right? It's the same thing. We do it for 3 years. We build out the plans. And I am happy to say that what I found this year with the plan, Louisiana Public Health Institute helped to lead the work in terms of being that conveyor of the groups. And frankly, what I've watched happen with these plans over the years, you know, when we first began doing this, or when I first started reading them, the hospitals were very focused on care, right? And how do you provide the healthcare piece of that? What I've started to see over the past 3 iterations is that now we are really getting to how do we get to the community? And how do we really do some things that are going to affect the community? You know, you can add all the clinics you want. That's really nice. But if they can't get to them, what's the point? You know, you can create some plans that I'm going to get behavioral health there. But if people don't really understand it or can access it, or you haven't provided it in languages that they understand, what's the point? Right? So you have these things, and you know, we can pat ourselves on the back that we did it, but if it's not being utilized, then what's the point of having it? So I think that the big piece for us this year, and what I've seen in terms of the maturity of the health system, is that we are really now turning that attention to how do we make these things work for the people that we serve, and that's a big accomplishment and a big change. So it's an interesting process. It's much like the city's piece, and I'm happy that we're aligned in what that looks like, because at the end of the day, that'll become the impact that we need to see across this community.
Thank you, Charlotte. It is really exciting to see the alignment, not only in timing, but focus and understanding as we've gone through this journey together. So, you know, as healthcare, public health is coming together, I'm going to bring in Jeff Schwartz, the head of the city's Office of Economic Development, to tell us how what we're doing is aligning with what you're trying to do in terms of community development.
Absolutely. Thank you so much, Dr. Vegno and Charlotte. You know, it's so great, even though I've seen the report and, you know, the CHIP plan, and, you know, I've talked so many times about this. It's so great to hear it at a high level. And I was already taking some other notes about some other ideas that I have. So it gets the gears turning for me. I hope it is for everybody else. You know, I think one of the highest level observations that I can make that I think is kind of really says it all is that so many of the determinants, those social determinants that, and in some ways it's tragic, but I kind of find it emboldening. So many of those determinants that color and really affect health outcomes are the very same factors that affect someone's economic outlook and attainment, right? And so what we are really talking about here is root cause issues. And when we're trying to address the staggering inequalities that exist in certainly in this city and in so many others, I think having this clear-eyed view that so many of the challenges that we're trying to solve can't be solved in silos, but that when we do start making progress on them, the thing that I take to heart is that we're going to be solving multiple problems at the same time that's going to have impacts on multiple fronts that's truly going to be improving individuals and communities, community members' lives. I think Dr. Vegno, you hit on a lot of my sort of go-to statistics. New Orleans, when you look at Gini coefficients, which are it's a measure of income inequality that the United Nations and others look at. Out of the top 100 metros in the country, New Orleans is 99 out of 100. I'm keen to point out that Atlanta is 100 out of 100. So I guess that's good company in some senses. That is a galling number. The other elements of this, when you actually bring it down to the ground, and I think I see, yes, Dejan Jordan from Broad Community Connections in the audience here. In my prior work on Broad Street, the statistic that we had 2 zip codes who immediately abutted one another in the city of New Orleans, 70119 and 70112, mid-city neighborhoods, right in the heart of the city. When the Kellogg Foundation and a couple of other think tanks looked at the life expectancy by zip code numbers, the number has gotten a little bit better in more recent years, but in 2013 that number was almost 20 years. There was a 2-decade disparity, not even among communities that were miles apart from each other, but literally across Highway 90, across Broad Street. And I think that from one another, and that speaks just so profoundly to how inequality really is a block by block and community by community level impact. Exactly, DJ, and no elevated highway cutting through it even. It's just something you can walk across, not as easily as you should, but it is an artificial barrier that clearly has so much impact on the day-to-day lives of New Orleanians. And so that is something that in my work in community and economic development is just so important. We haven't had wage growth in New Orleans in over 30 years, and frankly, a generation and going on to now, as Dr. Vegno noted, we still are at, the federal minimum wage level in Louisiana and in New Orleans, although we are doing some things at the city level to mitigate that with some of our own contracts and our own work. But the work really it's daunting. I mean, I think anybody who isn't acknowledging that is not setting any of us up for success. But I think that we have to acknowledge where we are in order to really make strides in where we're going. And so one of the things that our office is focused on, the Office of Economic Development, is something that we frankly have heard time and time again about during COVID, especially. And that is, this city has an embarrassment of riches when it comes to, the people, the culture, the natural resources, everything that we have here that so many other communities would frankly give an arm and a leg in order to have the assets that we have. But we do not do enough as a city to build wealth and then ask questions about who benefits from that wealth, right? And I think infrastructure is a part of that equation, and I'll speak a little bit more to that. But overall, it is about, how do we grow the proverbial economic pie in the city of New Orleans, and then look at instances about how we can actually then ask questions about equity, right? It has to be foundational to how we think about growing the economic pie in the city. And so I want to briefly just go over the work that we've been doing at a very high level, not talking about just immediate, COVID response and the like, but really thinking about social determinants and how we do the work of economic development in the city. And then, I am really looking forward to some Q&A. We describe this work as generational economic development. We have a plan for generational economic transformation that we'll be rolling out this spring. And there are 5 big buckets of that work. And hopefully many of these areas resonate with a lot of you. I hope that you see all of the different overlap, and I'll emphasize a couple of different areas with the social determinants that Dr. Vegno and Charlotte highlighted. The first bucket of work is place-based economic development, right? I think that the city of New Orleans does really great work in our procurement strategies. We have DBE requirements and local hire requirements in every single one of our contracts. The state does as well. We have an Office of Supplier Diversity and some other agencies like Workforce Development that work to really ensure that businesses and residents and workers are connected to as many opportunities as is possible. But frankly, we're not going to procure our way to equity. We're not going to procure our way to health equity. And so we know we need to go beyond that. Similarly, we are a city that punches above its weight, frankly, in terms of entrepreneurship and how we cultivate businesses that are trying to grow and create jobs in the city and address, frankly, some social challenges while they're growing their businesses. But the reality is that the vast majority of businesses in the city of New Orleans are not going to be looking for venture capital. They're not going to be growing to the point that they need Series A funding. So many of our businesses and those that we often celebrate as being a city of small businesses, they exist in our communities. They exist in place in commercial corridors like Broad Street and so many others that we know in New Orleans and beyond. And yet we have far too few supports for the small business owners who are doing that work in communities. Those are business owners where, frequently they're entrepreneurs of color. They are more likely to hire hard to hire populations like those who are reentering, from the criminal justice system. They are businesses that, setting aside their cultural importance in the city, are businesses that, frankly, are places where wealth is created in the city, much more so than in a lot of other instances. And so some of the work that we need to do is be really intentional about place and how disparity, as we were talking about, plays out by block, zip code by zip code, and be really deliberate and intentional about how dollars that we have to deploy in economic development are benefiting business owners and communities where they are in place. And so that is critically important. There's a lot of work that we can be doing there, and a lot of partnerships that we frankly can leverage with our place-based economic development partners, with our technical assistance providers, with our anchor institutions, very much, LCMC and others. So there's so much work to be done there. The second big bucket of work is what we're calling catalytic redevelopment projects. And those are ones where the city is in the driver's seat, where the city controls property. I don't think it's any secret to anybody here on this panel that the city owns a lot of property in the city and isn't always necessarily the best steward that it can be of those properties. And so part of the work that this plan is setting forth is trying to position the city to be more proactive about addressing its goals in affordable housing creation, in addressing health disparities, in creating jobs and wealth building opportunities for New Orleanians by using the assets that we actually have. And so you've already seen some of the early work that this administration is really focused on in, for example, the Six Flags redevelopment project that had sat vacant for 17 years. We are finally and long overdue, getting that property back into commerce. It is not always large sort of mega projects like that. It looks like the Louisiana Firehouse on Louisiana Avenue at LaSalle, basically, that has been, vacant for decades, frankly, that we now are working with the Redevelopment Authority on a community and economic development and affordable housing project, and sort of everything in between, right? Really granular projects all the way up through large scale projects. And these are some of the best levers that we can pull in terms of addressing some of the areas that are in our chip, right? When we talk about how we create affordable housing, we know we need to create affordable housing at scale. And using city-owned assets is one of the best ways that we can do it. And it's a national best practice that many of our peer cities have looked to for a very long time in creating housing and economic opportunity and addressing, disparities in place in communities as well. The third big bucket is around entrepreneurship. I think we all saw last year that the city of New Orleans has a huge amount of entrepreneurial talent. We had over $2 billion of exits, which are a good thing. The companies are still in New Orleans, but over likely it was probably around $1 billion of wealth was created overnight locally from that $2 billion. And, that is money that's going to circulate in the economy. There were a number of folks who now have resources to invest in their own businesses, in community-owned businesses. Those are resources that, frankly, didn't exist prior to last year in the city. And we need to be much more intentional about cultivating that ecosystem, and also asking, again, who benefits when that type of activity is happening. And so that looks like investing in BIPOC entrepreneurship, in women-led entrepreneurship. It's investing in our entrepreneur support organizations that are working on issues sometimes tangentially related to health equity and disparities, but also sometimes directly related to this when it comes to entrepreneurs who are doing things in the fresh food access space, right? And thinking about all the different ways that technology and incubator kitchens and the like can address real needs in communities that are being underserved by the food system, for example, and the real geographies of inequality there. I'll go briefly through the next bucket of work. It's workforce development and human capital. I think it goes without saying that workforce development is obviously the other side of the coin to economic development. You can't have a growing and thriving economy without a workforce that is well trained and well positioned to do the work that needs to be here, and vice versa. If there aren't jobs, you won't have workers who can afford to stay here. There are so many ways that work touches on health disparities and healthcare related work. I think we've all seen the shortages that exist. I'm sure Charlotte could write a dissertation if she wanted to on that at this point, Dr. Vegno as well. But really thinking about how our anchor institutions like our hospital systems, our public health system more generally, and in related industries can, how we can all work together to make sure that we have a pipeline of workers who can meet needs. And those also happen to be the healthcare industry more generally is an industry that pays better than average wages in the region. It is an industry of growth in a region where we desperately need to grow more legs of our economic stool beyond tourism and hospitality and the energy industry of the 20th century. Healthcare and the life sciences very much is a priority industry precisely because there is a career ladder and the ability for workers to move up in that industry. And so, workforce development and human capital is a key element of the work. And then finally, and I think this takes us all the way back to social determinants, it's really thinking about systems that support economic development. And this is probably a less than eloquent way of describing social determinants. But it is so critically important to look at affordable housing, to look at healthcare and benefits, to look at transportation as being integral and not ancillary to the work of growing and supporting our economic base in the city. And so our strategy is very much supportive of and has identified a number of action items where the city is going to be committing to addressing those frankly longstanding needs to better support not just economic development, but also the healthcare system and by extension address health and economic disparities at the same time. I know that was a lot, but I really wanted to get that information out there and all the different ways that we're thinking about economic development and all the different touch points that it has to social determinants and addressing health outcomes in our community. So with that, I will wrap up those formal comments and then happy to get into any Q&A.
Thanks, Jeff. I think what you just heard is three sides of the same coin, right? We all, and you know, I maybe it's not groundbreaking, but it sure seems like it, having done this work, and Charlotte, you know, doing it a little bit longer than me, is to have consensus between sectors that don't usually talk to each other, and that's the business sector and the healthcare sector, that we all need to invest in the same thing. So instead of spinning our wheels and being in silos, you know, there's a real, I think, synergy between us, and that we want to communicate to the broader community, because we just can't we can't do individual work anymore. That clearly hasn't gotten us anywhere. Charlotte, you unmuted. Were you going to add to that?
No.
So I think Nick, yes, we do need walkable cities with better public transit. That's one of our, one of the CHIP priority areas. And that I know transit is something that Jeff has been working on, as well as a workforce development driver in Charlotte, as well as a way to get people to the healthcare institutions when they need it. So that's a foundation of us, but that's a good maybe segue, just real quick from each of you, and then happy to take questions if there are any. What do you do first, right? There's so many things to tackle. I'll start with Charlotte. If you could do one or focus on one or two social determinants or key drivers of health and economic prosperity, where would you put your money first?
So, I mean, at the end of the day, hospitals and health systems are businesses, right? We have, you know, our trade is illness. It really hasn't been wellness, right? So the question is, when you do these community health needs assessments, how do you find a space that gives you the bottom line, right? Because we have to figure out how we're going to make sure that we keep our doors open. And that's getting harder and harder, right? That's not an easy thing to do. You know, the challenges with staff right now is extreme. I mean, I know y'all are feeling that at the city, you can't pay people enough to keep people. So in healthcare, that spirals out of control. So you don't have the people to be at the bedside, right, to make sure that people are taken care of, and it's hard. But I think if I put those two things together to try to figure it out, the issue around access is still big. And again, it's not, as you say, Jen, just focused on, you know, do I have the healthcare facility to go to? I think this is going to be one of those things that healthcare facilities are going to have to figure out how do I invest in those other things to make sure that people have really good, accessible healthcare. And, you know, UMC, I think, is a prime example of that. It is a big shining beacon on the hill. You know, all of our services happen on this campus. And while we have partners outside of this campus, you know, creating those partnerships are hard. There's got to be trust that, you know, if I create those partnerships, we're going to somewhat share those patients, you know, whatever that looks like. But in the most part, you're trying to figure out how do you get a patient and you keep that patient. Right. So UMC is going to be one of these places that we're going to have to rethink our strategy of sitting at the top of the hill. We may have to figure out how do we create some mechanisms for people closer to where they live to build that trust with them, that when they do need regular care, they can get it. But when they need that specialty care, right, then, you know, there are ways to do that. And maybe some of those specialties are out in the community. where people can get to them. So I think, that's one that kind of helps both sides, right? It helps to feed the piece of I need to develop new revenue streams for my hospital, but I also figure out ways that focuses on my community. And I'm always torn because, I lived in public health world and now I'm in the hospital world, and I thought I could put those two together. And sometimes it works, sometimes it doesn't. But I'm always taking it from the view of how does it affect the people, right? How does it affect my community? Are we making things better for them? And are we listening to them on what those needs are? I think the other big thing to focus on is the pieces around health literacy. I was listening to one of the other segments that happened earlier, and Doc Griggs was on, and Doc Griggs was talking about things that we call things, right, that people may not understand, right? So really using the language, not just the translational language of your demographic, but really using that down to earth language that people get, right? When you're explaining these and finding new words to make sure they understand what we're trying to teach, what we're trying to do, and that they can then connect to us in a way that's going to let them do something different. And so I think those are the big ones for us that I think we can touch on. And there, of course, many more things within the hospital, the pieces around people feeling discriminated against, right? If we can figure out what that looks like, getting more people that look like our patients to provide those services, so that, again, building trust. I am here and I have people who you can connect with to provide those services, and really doing a more intentional job of doing that work and finding people who do that, so that we can not only support the community, but get people within our community who our people can relate to. The majority of the people that we serve. I mean, because at the end of the day in New Orleans, it is 65% African American. We need to figure out how to put people in place to make that mix so that people build a trust with us.
So I'm hearing access, health literacy, and cultural competence, real meaningful work in equity from Charlotte. Great.
I think so, yeah.
All part of the chip. Jeff,
Yep.
What do you do first? How do you?
It's such a, yeah, where to begin? It's such a good question. There's nothing new under the sun. And so I feel like this is going to be a sort of fad way of describing this. But one of the big things in kind of urban planning right now is the 15-minute city. And I think that, if I could wave a magic wand and, recognizing that these are problems that were made over decades. And so we're not going to, unsolve them or unmake them overnight either. I think if I could wave a magic wand, it would be to start with reframing everything in place, right? And recognizing that, despite everything that the Internet of Things has brought us, and, Amazon and ghost kitchens and everything else, I think, disparity and equity still plays out in geography and in the world. And I think if we could come up with a method where all of our investments, economic development, public health, public and private sectors, that always incorporated an element of coordination and intentionality to have those investments happen, not just as the market decides, but where there was some very real intentionality about how those dollars are deployed in a given community. Until your zip code does not determine your life expectancy, I think we need to be able to say that, yes, we're coordinating infrastructure improvements, our blue and green, investments, and our access to capital, and how we even improve streetlights and landscaping, not to mention, drainage and everything else, in place in communities. And I think we all know what equity would dictate, what that would mean in terms of how we prioritize investments, if that was truly the lens that we were focusing on. So that's an answer. I can think of a couple more, but I think that is one. If I had one wave of a magic wand, that's one of the places I would start.
Great. I love it, Jeff. I think we should take some questions now. I do see one in the chat from Nick. How do you use social determinants, vulnerability index data to make an impact? That's a good question. I think you start by just making it available, right? And so that's one of the things where we were excited about the chip, and Charlotte's, the hospital needs assessment has that to some degree too, is, I think a lot of people, for whatever reason, like not deliberate, don't know just how stark the needs are. I know that there's been a lot of work to try and highlight, poverty and Alice households with the United Way, and various organizations, I think, try to highlight whatever their particular issue disparity is. But what we're hoping to do with the chip is put it all in one place and say, this is the picture. It is not a pretty picture, but make sure everyone has access to it. One of the things that we're hoping to do out of the chip is to have a dashboard, so that when we come up with what the plan is for each of those priority areas and sub goals, you will see what we're doing about it and how close we are to getting there or not getting there, right? Is what we're doing working? How is that moving the needle? A lot of these indicators, simply doing a new program or an initiative, as Jeff alluded to this year, you might see gains 20 years from now. And in fact, my votes for what I would do first as really the infrastructure, to get back to our title of the foundation, is early childhood and maternal child health. You might not see that for 5, 10, 15 years, but when you see it, it will be transformative. So we have to recognize that, we have to start to become familiar and comfortable with the data. We have to not expect them to change immediately, but to figure out how, as a community, we can all talk about it, right? If we all really understood that, 25% of everyone in the city lived in poverty and what that meant, and every one of us had conversations about that because we were seeing those numbers and living with them, I think we would do things differently. And as Jeff said, maybe we would make some investments a little bit differently, simply by having access to the data. So thank you for the question. I don't know if anybody else has any other thoughts. I guess a corollary to that is, how would you encourage everyday people to get involved? Well, I think we're all everyday people, right? That's the only way you solve this, right? It's not by hiring some consultant or some academic in an ivory tower. It's the people that live here. But Jeff, Charlotte, how do you think that the average person who really does want to see New Orleans succeed can get involved?
So I think for me, we talk about the social determinants. I think you got to find the things. I don't want to say low-hanging fruit, because again, that's just another cliche. That's not it, because some of this stuff might seem like low-hanging fruit, but it's really hard work, right? But how do we pick some things that you can get the everyday person involved in, that they are going to see some result of it, right? Because it's like we need to pick things that we can measure. Sometimes we're not that measurable. We want to save the world, and we can't save the whole world at one time. We have to figure out what are those things that we're going to be able to make a difference with. And we all know we do the things that we can measure, right? That's what we should be doing. So it's finding those things that we can put a good measure to, that can be somewhat attainable. And then you can then connect people to that, right? That they can see the difference of, if I did this, then, I can see that result. I agree with you, Jen, that investment in early childhood, it is important. But I've been doing this for 15 years, and I've watched multiple people do investments in early childhood, and we're still struggling because those other pieces, right? The magic wand would be that you get all the money in the world to fix it all at one time, so you can really see the results. And so, early childhood is a hard one to see, because you really don't see the results of that, especially when you have other problems that are big and right in your face, whether that's like violence, right? And people talk about if you work on violence, those teenagers, right? You catch them when they're young and we won't have that problem. Well, we're still trying to do that. And so I think it's one of those old sayings about, you only bite off a piece of the elephant, right? And we just have to figure out how do we get some wins so people can see some wins and how that's effective. And then you can continue to build. You got to do both of them at the same time. Bigger picture things along with some smaller things that you can actually see and measure.
Jeff, any thoughts?
Yeah, I mean, those are such thoughtful responses. Yeah, I mean, the only thing I would add is, I think it's finding ways to have more two-way conversations, and I think something like a chip and the corollary work that, the hospital systems do, we have to create better soft infrastructure that it allows for that engagement work to happen to really inform decision making. And so, I don't think there's not an easy answer for ways for everyday people to do meaningful work, because I think I don't want to put all of the responsibility just on quote unquote everyday people, right? And I think there is the responsibility of institutions, of the public sector, and large private sector partners as well, to, I think, really be committed to engagement and having community voice inform and needs inform decision making. So I think I don't know that there's an easy answer, but I do think that engaging with institutions is one of the best ways to do it. I think I'm an evolutionary kind of a person, maybe more so than a revolutionary. Maybe I'm just showing my years. We probably do need a revolution, but just seeing how things, tend to change, it is incremental. And I take heart in that, but it doesn't happen quickly enough. And so, my hope is that we can, find more opportunities for engagement, building, more structures, on the ground that can help amplify community voice. It can be very time consuming to have to engage all the time, I know as well. And so finding, ways to, create conduits for that conversation to happen too is really important.
Yeah, and I think demonstrate, for those of us in institutions, demonstrate accountability to the community in which we serve.
Yep.
Did you respond to the email? Did you answer the question? For Charlotte, it might be, did you follow up with the patient? Did the patient get that appointment that they needed, right? For Jeff, it's, did that entrepreneur get their permit, on time, in a way that would allow them to operate? We bear the responsibility of that. The community, we should be seeking those voices and highlight it.
Yep.
And someone says they are huge impediments. You are absolutely right. Accessibility and engagement. It's really, really challenging. I just want to, several of folks have mentioned unaffordable housing. We could not agree more. That's why it's a cornerstone of our plan.
Yep.
And Jeff's plan. And I know the hospitals are focusing on it as well. It is one of the core foundational needs that needs to be addressed, no question. There was some discussion of community health workers. The community health workers, it's really broader than that, but they have really incredible roles to play. A lot of our clinics are using them to great success. We are using them in some of our programs. We hope to expand that. That is a win for workforce development, which is a win for economics. It's also a win because it improves patient outcomes. So you have healthier people, more jobs, and doing real meaningful, productive work. And so, there's been a lot of work at the state level to try to standardize what community health workers are and do and don't do, so that they can be a reimbursable service, because right now that's not set up quite so well. So we are hoping to harness that. We just got a big grant that is allowing us to employ community health workers to do COVID related, but also more than COVID health literacy efforts. And it's exciting, but we shouldn't have to rely on grants for that. So that kind of workforce development is, double bang for the buck. And I think I have 1 minute left. So in that time, I want to thank you guys for some great comments. My panelists, as always, lovely to be with you. And again, to the Urban League, thank you so much for having us. These are really critical days, and we appreciate you you listening and having this conversation.
Thank you so
You're here.
much.
Thank
Thank you,
you.
Dr. Vegno. Thank you, Charlotte. Thank you all.